Hello everyone, hello there. So I'm going to be recording my section of the workshop from the other day. Hopefully you find this part valuable. The whole point of this is obviously after a vehicle collision, there's many aspects involved to recovery. Part of that's your body, right? That's what I'm going to be chatting about. Your mind. So that's why I wanted Kim Law there. She's a registered psychologist and really helping overcoming any neurological or brain activities that can be impeding a recovery. And obviously sometimes people do have permanent impairment, severe injuries, and it can severely impact their quality of life. And if you have a spinal cord injury and you can't use your legs anymore after a collision, well, that's really serious and it's going to be life changing. So then we need the legal system involved. And that's why we had him there. Sorry you weren't able to make it, but it was really great. And I think everyone there shared. Well, I know Kim and Joe shared fantastic information, and I hope what I shared was also valuable. So we're going to go over that right now. So I don't have a coin here. It's hard to do over a screen, but pretend I'm flipping a coin. What's your choice, heads or tails? So just think of that in your mind right now. And the reason this is important is if you picked heads, congratulations, you likely are going to be feeling pretty good in about within less than a year or so. You're going to recover fully and do great. But everyone else, if you didn't pick heads, if you got tails, well, statistically, the odds of having chronic pain after a vehicle collision are basically the flip of a coin. About 30 to 50% of people who have symptoms after a vehicle collision still have symptoms up to 1 year later, and which is a crazy high number if you think about it. Sometimes people think, well, I've had this problem before, I've had this neck pain before, I've had these headaches before, I've had back pain or any of these issues before. It's not a big deal, it's going to get better. But statistically, those chances aren't very much in our favor. This cover is a book that I wrote. You can get that on Amazon if you like. Edmontonians recover faster from pain suffering of a car collision. And I like this diagram because it kind of highlights a lot of things that people kind of say when they come to the office here. They're in a vehicle collision and they have a lot of pain and problems, but their car is fine and they feel fine and they can live with it. It's not that bad. But again, statistically, up to 50% of people have these problems still 1 year later. So how can we make it more likely for you to make a full recovery so you can put this collision or accident behind you and not have it significantly impact your quality of life moving forward? A lot of times people think that more damage to a car means that you're going to have more severe injuries. That it's just a minor fender bender. There's barely a scratch on it. You should be fine, right? And if a car is totally destroyed, you might be really hurt, really injured. But we know that this isn't the case. This isn't the case at all. We are not made of bone, or we're not made of metal and steel, and cars aren't made out of flesh and bone, right? And cars are meant to kind of get banged up, and we don't have as much tolerance for that. And we all know, or I'm sure I know, a handful of people that I've talked to that have been in severe injuries or severe collisions rather, thrown from their car, the car totally demolished, totally destroyed, and they feel completely fine, have barely a scratch on them. And I've had people in the past who have been in seemingly minor collisions or minor fender benders, and they feel fine initially, but they may wake up a week or 2 weeks even later and they can't move. And they're in debilitating pain and it significantly impacts their quality of life. So we got to ask ourselves, why is it that vehicle collisions are a little different than other types of injuries? Slip and fall. Typically, normal tissue healing time is about 8 weeks, 12 weeks, sometimes a little longer or a little less. But typically in a normal situation, injuries should heal within about 3 months or 12 weeks. But why is it that up to 50% of vehicle collision accidents, injuries from those, are still there present a year later? And that's what we're really going to get in today. So when I practiced in Lloydminster, I had a patient that I was treating for back pain and some neck problems. And time went on and he got a lot better. And then we said, okay, come on back if something's bothering you, down the road. Well, I saw him a couple weeks later actually, and he had been rear-ended. He was driving a truck and trailer, and he was barely nudged. He barely even felt the actual impact happen. Car had rear-ended him and kind of bumped him just a little bit like this. He said he barely felt it. He got out of the car, felt fine, went and checked on the other driver, and they were okay. Their car wasn't, but the person was all right. And time went on. Well, a couple days later, his neck started feeling a little stiff, a little tight, and he decided to come in again because he had help last time. So he had come in again, and we did a full workup and diagnosed what was going on. I told him, you're going to be a little stiff and sore over the next couple days. I gave him some exercises to do. These are very important to do. Make sure you do them. And we'll follow up in a week. That's what I said, something along those lines, and he was all right with that. So a week went by, and then 2 weeks went by, and 3 weeks went by, and I ended up seeing him about 4 or 5 weeks later, and he had come into the office, and his wife was walking him in. This is a big, strong guy, and his wife was walking him in. It looked like he had a very hard time balancing. He had dark sunglasses on, shades on. He was having, I was kind of shocked. I was at the front desk when he had walked in. I was like, "What the hell happened to you?" So we went back into the treatment room, and we got to talking. Well, it turns out that he said, "Well, I was still a little tight and sore after my visit with you last time, so I decided to go get a massage, and I've been getting physio done every single day since I've seen you last." So within a couple weeks period of time, he had probably had 25 treatment sessions, and I say the word treatment quite loosely here, and he was just a wreck. It was probably one of the top 5 worst injuries that I've seen in my years of practice so far. So all this to say is that just because there's minor damage, that doesn't mean that your injuries aren't quite severe and quite impactful on your quality of life. I had moved on from that practice afterwards. I'm not sure how they fared after that, but there's a reason I give suggested treatment approaches, and there's a reason I don't suggest massage for 20 days in a row. Sometimes things like this happen. Okay, so the good news is that there is a path to help reduce the odds of developing chronic persistent pain after a collision. So instead of 30 to 50, we can significantly reduce that. And if you do end up with chronic persistent problems, we can reduce the odds of those being high impact on your quality of life. Or said another way, sometimes people do end up with chronic pain afterwards. But there's a difference between chronic pain, where you can't function, doing any type of chores are very difficult and extremely painful, compared to reoccurring issues or constant pain but very low grade, where it's very easily managed conservatively, and it doesn't significantly impact your ability to live life. So there is a path to do this. But first, I just want to go over a couple of different things that are very common after being involved in a motor vehicle collision. So what are the symptoms? Now, everyone knows about neck pain. Some people know about headaches. But the reality is that in a vehicle collision, you're getting thrown around by thousands of pounds of steel. Your whole body's getting thrown around, either forward, back like this. If it's a side collision, then you're going to kind of whip back and forth like this. Sometimes our hands hit things. Sometimes the airbag goes off in our face, into our chest. Sometimes our knees are against something and they hit the dash, or hit even the door, or our legs get crushed. So really anywhere can be symptomatic and have injuries. Oftentimes people are more noticeable about the most painful area, oftentimes the neck, not always, but oftentimes the neck. But they may also have jaw problems. They also have headaches. They may also have issues with their shoulder, with their arm, with their knees, hips, feet. Really important that we address all these problems, not just the most painful one. This is another reason why people are more likely to have persistent issues if they don't all get addressed. And sometimes our brain or mind can really only focus on a few things at a time, so it really prioritizes the most painful area, but it doesn't mean that's the only area that needs to get worked on. So pain or stiffness or aches or reduced range of motion on your head, neck, back, shoulders, hips, knees, ankles, elbows, wrists. You can get numbness, tingling, headaches, TMJ problems, very common, really anywhere in your body. And there's some other common symptoms that are less known about. These include things such as dizziness, kind of feeling off, disequilibrium, kind of feeling like you're falling, anxiety, depression, extremely common after a vehicle collision. Kim talked a little bit about this as well during the presentation. I'll talk about it a little bit, but extremely common, and that needs to be addressed. Or else, again, you're more likely to, if it doesn't get addressed, you're more likely to develop persistent or chronic pain issues. So, what is the process? What do we do? Well, the good news is there is a process, and the first thing we need to do is come up with a diagnosis after an exam and taking your history. So we got to figure out what's injured, what tissue specifically, how it's impacting your quality of life, how it's impacting your day-to-day routines, and how you are functioning. Just because something's injured doesn't mean you're functioning poorly, and just because there's no pain doesn't mean there's not functional impairments. I've had a lot of people where they don't have any neck pain, but they can't turn their head. They're like, this is their range of motion. I ask them to turn their head to the right, and they look to the right, and that's how much they can turn their head. Other times people have, like I mentioned earlier, dizziness or balance issues. We're going to get into that a little bit. And this is oftentimes are in the absence of pain. You may not have pain, but you have these functional deficits. So we need to identify those. And oftentimes I'll get patients that are coming in and they may have had an injury or an accident, and they're doing rehab, but it just doesn't seem to be working. It's not working for them. And the question we always want to ask is why? Why isn't this rehab working? And usually it's because the diagnosis is wrong, or the treatment approach is wrong, or you're doing the wrong rehab. For example, if you're having concussion-like symptoms, headaches, dizziness, trouble standing, trouble with your balance, I don't care how many bicep curls you do or squats or lunges you do, that is not going to improve unless you do specific rehabilitation exercises for those issues. Okay. I've had patients in the past where they were getting treated for concussion, and the person had them doing shoulder presses. They were getting crazy amount of neck pain and dizziness, and the person had them doing shoulder presses. It doesn't make any sense. So we got to make sure we're doing the right things in the appropriate treatment. Obviously, we can do various different treatment strategies depending on what's injured and what the problem is. And we need to tailor these approaches differently for different people. So we oftentimes, when people aren't getting the appropriate care or they're not doing the right rehab, they're going to get kind of 3 steps forwards, 2 steps back, kind of, I'm improving a lot, but then it kind of regresses quite a lot. And one of the issue is that these people aren't typically being continually reevaluation of their progress, and they're not being given new things that need to be more appropriate for them at that period of time. So if we have, for example, 2 people, let's say they're twins, okay, and they're both in an accident. They're both in the same car, they have the exact same injuries, so they're very identical, right? Same injuries, same problems, everything's the exact same. For twin 1, we might do one type of therapy, we might do an adjustment, some stretches, a couple different specific exercises. And twin 2, we may do the exact same thing. You see them a week later, and twin 1 is doing amazing. I'm 50% better. I feel amazing. Whatever you did was great. Twin 2 might come back and say, whatever you did to me, don't ever do that again, because I feel terrible. I'm worse than ever. So the question is obviously, what's the difference between these people? I'll let you think on that for a second. Well, the difference is obviously that the people are different, right? And different people respond differently to different therapies, to different treatments. This is why we need to continuously monitor and change our treatment approach and our rehab as things move forward. If something I do on day 1 is terrible and didn't work for you, well, I'm probably going to be doing something different on day 2. If what I did was really great and helped you a lot, I may do a similar therapy on day 2. If I'm giving you a certain exercise and at first it's quite challenging, but you're finding it quite helpful, but then after 3 weeks you're like, it's too easy now. If I give you that same exercise and say keep doing it for another 3 weeks, it's just wasting your time. We need to give you something more challenging so you can continue to progress rather than staying the same way that you are. So this is why there's a continuous diagnostic, treat, reevaluate process occurring to make sure that you're getting the most appropriate care at that period of time. There's 2 main issues. So there's 2 main things that can occur with persistent pain. One is how it's called your pain neuromatrix, basically how our body interprets injury and pain and how that can perpetuate into chronic pain. But I thought I'd talk more about the postural control system today, because if that is impaired, then that can also lead to persistent or chronic pain afterwards. So by addressing these issues, we're able to reduce the likelihood of developing chronic pain. Rather than 30 to 50%, hopefully bring that down significantly. So here you can see in the kind of left-hand side of this, we have 3 systems that control our postural control. It is our vision, our eyes. They tell us where our head is relative to everything around us, our surroundings. There's your vestibular system, or your inner ear. It's kind of like a level. Those levels, they have those bubbles. As you tilt them, the bubble kind of moves. That's what that vestibular system does. It tells our body where our head is relative to gravity. So gravity's pushing down, I know I'm upright. If I'm like this, I know I'm tilted because my vestibular system. And then there's also our muscle spindles, essentially our body and primarily our neck. It tells us where we are in space and allow us to maintain posture and control. If you look at the chart here, at the top, that afferent information, that sensory information from these systems gets transferred into the sensory area in our brain, okay? And that tells us where we are. That way we're able to send that information over to the motor cortex as we keep going around the circle, or to our body, and it tells us what we need to do. So based on where we are, we know what we need to do, okay? If you don't know where you are, it's hard to tell you what to do, your body what to do in order to get it to do what you want it to do. It's kind of like looking at a GPS. If you want to go to Starbucks, you type in Starbucks in your phone, right? And it says, turn right and go 300 meters. And then it's on, your destination's on the right? Because it knows exactly where you are. If you're in a different location, then the directions are going to be different. Now, what if your GPS didn't know exactly where you were? What if it knew that you were somewhere in the city? Okay, so you're in Edmonton somewhere. Well, it's not going to be able to tell you how to get to Starbucks. It's going to say, travel that way for a period of time and you might get there. So this is one of the reasons that we can develop persistent problems, because a dysfunction or an injury to our postural control system, an injury to our eyes, an injury to our vestibular system, more often than not, an injury to our body, right? This is going to affect that sensory information to our brain, and it's going to cause persistent problems. So what our body does when this information isn't accurate is it causes a lot of muscular tension, a lot of contraction, in order to try to protect you. Now the problem is this can perpetuate the pain problem. So to illustrate this sensory information of our neck, I want you to understand that the muscles in your hand, they're called lumbricals, some of the muscles in your hand, they're basically here, and they move our fingers around. They do this for our fingers. There's about 18 spindles or sensory spindles per gram of muscle tissue in our hand. And we know how dexterous our hands are. They're able to do a lot of fine motor tasks, write things with a pen, right? We can write very nicely, or I can't very nicely, but I can write. And we're able to do a lot of great things with our hands. Now, I'm going to get you to guess, you can say it out loud if you want, or just in your head. How many spindles do you think are in your neck, right at the base of your neck, right at the top here? I'll give you a second. There is about 286 spindles per gram of essentially sensory information coming from these muscles in our neck. That is how proprioceptively dense those tissues are and how important they are for maintaining posture and control of our bodies. So you can imagine that if your tissues are injured, if your neck is injured in a vehicle collision or another type of whiplash scenario or another type of injury, how it can contribute to a loss of posture, which can cause kind of dizziness kind of that disequilibrium, cause persistent pain to perpetuate forward. Extremely important. There's 16 times more more sensory spindles in our necks, in the upper area of our neck, than in our hands. So we're going to get you to do a little bit of an activity here. Okay, so I'm going to get you to touch yourself. Not there. Come on, let's keep this PG. I hope that made you laugh. This was better. This is better joke in person, but here we are. So I'm going to get you to take your two fingers, okay, and you're going to touch the base of your neck. So I'm just going to turn around here. So right here, right where your skull meets your neck, kind of right in there, okay? Not pressing hard, just gently touching there, okay? You're going to close your eyes and then move your eyes back and forth, up and down. You should be feeling those muscles just gently kind of flickering a little bit underneath your fingertips, okay? And the reason this happens is because it's a very ingrained reflex that we have, our cervical ocular reflex, okay? It means that our neck is connected to our eyes. So when you look to the right, typically you're going to turn your head to the right. So this reflex makes that response a lot faster. If you hear your name off to the side here, okay, what do? You quickly rotate your eyes and turn your head, right, to see what's going on. You're in a jungle and there's tigers and lions trying to eat you. You hear a noise, you quickly look and turn your head, right? So that's an ingrained reflex that occurs. Now, with any type of injury that injures the neck, it can actually impair or damage that reflex, that cervical ocular reflex. There's a couple different reflexes that we won't get into, but that one specifically can be quite impaired, and that's going to cause a lot of problems, because if our neck is injured, it's going to be relaying inaccurate information to our eyes. So then our eyes are going to have a very challenging time to stay focused on a certain object. Now the eyes are interesting because they move around inside of another inner side of our head. So our head moves around, but our eyes stay in one area. That's why I'm doing this. My eyes are staying focused. The reason they're able to do that is because of the sensory information from our neck is transferring that to our eyes, and our eyes can adapt quickly. Now, when that reflex is impaired or damaged or injured, the eyes can't do that anymore. They can't stay focused on an object. This is what's going to cause a lot of dizziness, maybe not spinning vertigo, but it can cause kind of like fuzziness, or if you ever gotten car sick in the back of a car, there's things moving by you and you kind of get a little sick. You can't focus on things, loss of balance. These kind of issues can largely be responsible because of this type of injury. So I want you to picture for a second that you're on a tightrope, and or you're walking a line. You're walking a line on the sidewalk. You know, it's not too bad. It's fine. You feel fine. Now let's bump, and you're able to do it. Now let's pretend that you're 3,000 feet in the air above this crevice, like this guy here, right? You're not going to be feeling fine. You're probably going to be on edge, forgive the pun, but you're going to be extremely hyper vigilant, hyper focused. Nothing really is going to matter except trying to maintain your posture and balance on this tightrope, because if you fall, you know, one little misstep and then you're toast. So in a usual situation, when you're on the rope, you're hyper vigilant, but once you get on the solid ground again, you're back on the ground, you can relax, and your nervous system and your body is going to be able to relax and just kind of calm down again. Now, what happens with a person in a vehicle collision, for some people, they can't relax. They're constantly feeling like this guy on the rope 3,000 feet in the air. They're constantly on edge because their postural control system has been impaired in some way or damaged in some way. So it's fighting really hard all the time to maintain posture, to maintain balance, so they don't fall, so they don't injure themselves. You can see how this is going to cause a lot of stiffness, a lot of tightness, it can contribute to a lot of anxiety, can contribute to a lot of persistent pain. If you're always like this, always wound up, it's going to cause a lot of problems. So this is one of the issues that we need to address. Now I wanted to give you guys some resources, some great resources you can check out online. This is just the website here, Canadian Chiropractic Guideline Initiative. If you go here to that website, and you go to clinical or clinician patient resources, you can click on these different conditions and it'll give you a good summary and overview of some evidence-based treatments and some exercises and these types of things that you maybe find interesting. This is also another part of that website, CCGI/research. So if you even just go into Google and type in Canadian Chiropractic Guideline Initiative exercises, this will come up. And they have some for the low back and neck pain and shoulder pain. And I use this quite often and give to people. Here's just an example of, if it'll play, I can't get it to play. But it shows us several different exercises, mobility, stretching, strengthening exercises to help improve these areas due to any type of injury to those areas. I'm a little disappointed it won't play for me, but just take my word for it. They're there and they're great. So give those a look, okay? So there's also some functional tests here that we can get people to do, and I do all the time. I wanted these to play, but they're not doing it for me. Basically, okay, I'm just going to do them. So this is the marching test, okay? So again, this is in the absence of pain. This is that really tests your postural control and your balance. So the first one, I'm just going to demonstrate here. You're going to be marching, so you're going to close your eyes, okay? And then you're going to be marching basically like this, tapping your heels or your knees to your hands. And you're going to do that for about 30 seconds. Now, sometimes people are just going to be able to do that, no problem. Other times, if there's a big problem with your postural control, oftentimes people will gradually turn. And by the time after 30 seconds, you're initially facing this way. By the end of it, you're facing this way, or even all the way around. So that just illustrates that there's clearly an issue there. This is another one, so it was called Romberg's. Essentially, you're going to stand with your feet right together. You can't see my feet, but just know that they're together. And you stand there with your hands by your sides, and you should be able to do that nice and easily. And you can do it with your eyes closed as well. And again, that should be no problem. If you can't do that, then we know there is a problem. One leg standing, so the exact same thing with eyes open and with eyes closed. You should be able to hold that with your eyes closed, each leg one at a time for at least 10 to 15 seconds, like easily. If you can't do it, there's a big problem and that needs to be addressed, or your risk of developing persistent pain just goes up. Okay, there's some other exercises that we'll do or tests. Smooth pursuit, basically, we've all seen this. It's like that sobriety test. It's not a sobriety test, but tests different things, brain functions. Essentially following your fingers like this, side to side, the H pattern that they do in the movies. Doing that, you should be able to do that without any problems. Back and forth a little faster as well. There's another one as well where you're looking at an object and then you're turning your head, keeping your gaze on that object. A lot of time when there's an impairment with these issues, with these injuries, you can't do that. And doing these tests sometimes will actually make you feel a little foggy, a little dizzy, uncomfortable. Sometimes it causes pain even. It's because there's an issue with your eyes and reflexive control with your neck. So that needs to be addressed and fixed if you are to make a full recovery. So a little story here. I had a patient more recently, actually, very recently, and they were in a vehicle collision the end of last year. And they were seeing another provider locally. And it's been about 4 months or so since they had started getting treatment. And they were feeling a lot better, about 50% better in terms of their pain, but they were frustrated with their lack of progress. And rightfully so. Again, a lot of times people think it's not that bad of an injury. Why is it taking so long, right? I should be fine in a day or two, but they're not. So it gets very frustrating. And so this person, she started developing headaches. She started developing weakness in her right arm and right leg, actually. And she's getting a lot of headaches and neck pain. And she felt better, about 50% better, but still not great. So the person suggested, maybe you should see a chiropractor as well. Maybe they might be able to help you as well. So as I was chatting with the patient, taking your history, doing an exam, I asked, what did your physio say? What was happening? Why did they say you're still having problems? And the response was, well, they say I'm really tight. And this is never the reason. You're never hurting because you're tight. You may be stiff and tight, and it may hurt, but the real reason that you're hurting is not because you're tight. There's a reason you're tight. And that is the reason that you're still hurting. And a lot of it has to do with this postural control problems. Again, if your body's response to, if it doesn't know where it is, its postural control is impaired, it's going to tighten up those muscles. So this is a classic example too, when people are always tight and always stiff, their neck's always stiff, and they can get a massage every single day, and it feels great when they get it, but then a day or two or a week or so go on, and they just tighten back up. It's not because you're tight, it's because their postural control is impaired, and your body's causing this neurological stiffness or tightness. So without addressing that postural control system thing, it's just not going to work for you. So back to this person. Again, her name wasn't actually Haley. This isn't actually a picture of her, but just to illustrate. So I did an exam with her, and she had pretty good range of motion. Not terrible, not the greatest, but not terrible. But movement was painful. She wasn't able to do certain tests. She wasn't able to hold her neck up very well without pain. A lot of these postural tests were not very good. She had very little strength in her hand and in her leg. There's just nothing there. She was really concerned about dropping her newborn baby, and rightfully so. You don't want to drop your baby. I have a baby, and that would not be good. So, very concerned, pressing big problems here. Also with her, she had terrible balance. So remember those tests that we're talking about, the one leg standing, Romberg's test, marching test, and marching test. She could not do these. She could do it with her eyes open, but once she closed her eyes, she was falling over within like a second or two. She couldn't do it. And this isn't just have them do it once and see if they fall down. This is like every single time. We probably had her try to stand on one leg, each leg, probably like 3 to 5 times, and she was getting extremely frustrated. Like, why can't I do this? And almost like anger, right? It's very frustrating. She didn't know that she couldn't stand on one leg. She didn't know her posture and her balance were severely injured and impaired. So, this was one of the main reasons that she was continuing to have pain, that she was continuing to have problems, and that she was starting to develop headaches, and that she just wasn't getting better because. From what she said, they weren't doing anything to really address these problems. No one had even pointed them out to her, which was really sad. I see these problems all the time, and they don't get addressed. So, moving to a bit of a different topic, people always ask what's covered under your collision for your vehicle accident. So a lot of times people don't know that they actually have insurance coverage after being in a collision. If you've never been hurt before and now you have been hurt, why would you know? And I'm sure you've talked to your, what are they called? The adjuster, your insurance broker on the phone after an injury or claim. I'm sure you've talked to your claim adjuster on the phone, and they were maybe pleasant, maybe not. And typically they say that you have, they kind of go over your coverage, but a lot of time they kind of breeze over it, and we miss things on the phone. And they say you're able to go see someone for your injuries if you feel you need to. The big problem is that if you feel you need to. My opinion is that if you've been in a vehicle collision, you need to go get checked out, even if you're not having any pain. Because again, pain isn't the biggest issue. This impairment to your postural control system is a big problem. And I've had patients come in 10, 20, 50 years after an injury, and they come in with the neck pain that comes out every once in a while, ever since that car accident, because they never fully rehabilitated themselves afterwards. And this is why it's so important. So what's covered? Here's a couple websites you can check it out. Essentially, for chiropractic care, you have up to 21 visits within 90 days. Okay, that's plenty of treatment. That's plenty of care for a majority of cases. Sometimes that's not enough. And if it's not enough and you need more care, then you have up to $1,000 of coverage for up to 2 years after the collision. And also, if you have any private insurance as well, that kind of goes in there as well. So there's a lot of coverage for you if you need it. This is taken from College of Chiropractic Association website. Essentially, what do you do if you need care, if you need treatment? Again, you're in a collision, file a report. You should go see a primary health care provider, chiropractor, physiotherapist, physician. I'm a little biased towards chiropractors, but understandably so, I'm sure. But you need to see someone. You need to fill out for appropriate forms. There's a bunch of forms they're going to fill out. This is just some stuff you can take a look through if you're interested. Okay, so to summarize, a lot of times people feel fine after an injury. They can live with it. They can live with the pain. It's not that big of a deal, they think. But the reality is you don't need to, and you shouldn't have to. And if you want to limit your chance of having persistent or chronic pain after an injury, well, you need to go get some help. You need to go see someone, get assessed, appropriately diagnosed, and provide an appropriate treatment plan. This may involve, you may not need any hands-on care. You might only need a couple different exercises. This might be pretty straightforward, but it also might not be. If you want to reduce your chance of developing chronic pain, I suggest you take some steps to do that. And there are professionals that are able to do that for you. I'm going to leave you off with a little story here. This is a patient of mine. First I saw her, it was a year or two ago. And she was getting some treatment at a local provider around the city here, around town. And she was in a vehicle collision, and she was doing actually quite a lot better. So they were able to get her pain down to where there was no pain unless she decided to do anything. So if she was just sitting there, bump on a log, not doing anything, she actually felt fine, which is great. A lot of people don't even get that far. But for her, if she were doing any house chores, doing the laundry, clean the house, go for a run, exercise at all, do any type of physical or any type of work that required her to move her body or use her body, she would have pain. And sometimes that pain would linger for quite some time. But she'd kind of come to terms with it, and she's like, okay, this is just going to be my life now. Their provider suggested getting some orthotics because they thought that might be a little bit of help as well. So they looked us up and saw that we do orthotics. So she came in for some orthotics. I told her, how about we do an exam and I'll let you know what I think. We can do some orthotics as well if you like, but would you like another opinion? And she was inclined to do that. So we did a workup. She had a couple of these issues that we talked about earlier. And I told her, I don't really think you need orthotics. They might help your feet feel a little better, but I don't think they're going to do anything for anything else. Maybe a little bit, but I don't really think you need them. I'll sell them to you if you want. I'm more than happy to take your money if you want those orthotics and you're die hard on those orthotics. But I actually think you need a couple of these other things first, at least, to kind of get you a little further down the road. I think we can get you feeling a lot better doing these other types of therapies. And she kind of was surprised, I guess, and didn't really want. She wanted to think about it. We'll put it that way. And so we didn't do treatment on that day. I didn't think she'd come back, but about a month or two later, she decided to come back and decided to actually start some treatment. And I'm sure she's glad she did. She wrote this I asked her to write a note, and she wrote this for me. I'll just read it here quick. Good day. I was asked if I'd write a little something. Something that'll definitely make your life easier, and of course I said yes. Hi there, my name's Patricia Stransky. You and I have never met. We probably have a lot in common when it comes to our health. Things like I was in pain and wasn't able to do much. In my case, it was due to a whiplash injury or due to injuries from a car accident. I couldn't even do simple household chores without pain. I was starting to put on extra weight, and the doctor's prescription drugs weren't helping. I progressed as far as I could with physiotherapy. Your life may be different, of course, yet you're still facing problems that slow you down. But the reason I'm writing is because I found a solution that might be helpful to you. His name is Dr. Joseph Tanti, and he has been the added support I was looking for. I found him at Capilano Chiropractic Clinic, made a phone call, and they answered my questions, so I decided to give them a try. Here's what happened next. Dr. Tanti took the time to fully explain how he could help me. But before offering me a treatment plan, he consulted with my physiotherapist, ensuring that the plan was right for, some of this is cut off, me. Dr. Tanti was not going to do anything I was uncomfortable with. For example, I was not comfortable having my neck cracked, so he used other methods to provide relief. After 1 month, I felt the best I had been since the accident over a year earlier. Better yet, I'm now completely off the pain pills. Dr. Tanti and the folks at Capilano Chiropractic treat me very well and have been instrumental in giving me my life back. I can do regular household chores without experiencing excruciating pain, and have taken up some of the hobbies I hadn't been able to do, like gardening. I feel better than ever, and the folks at Capilano Chiropractic are incredible. I encourage you to call Dr. Tanti his office with any questions you might have. He's knowledgeable, friendly. He won't try to sell you anything you don't need. You can call him at, she puts the number, and the rest of it's kind of cut off at the bottom here. Do this. Well, all right. Here it is. Or if you're not ready to talk to anyone, Dr. Tanti can email you a helpful report to explain what's possible to relieve your pain. Just send an email to my friend Dr. Joe at joetanti@drjoetanti.com. Thank you for taking time to read this letter, or in this case, listening to me read it. I hope you give Dr. Joe a try. And if you're having any pain or any problems that you're dealing with, I hope you give me a try as well. I'm sure we're able to help you get some relief, or at least help you get some answers and point you in the right direction. Like I mentioned earlier, if you have any questions or concerns or anything like that, or dealing with any issues, feel free to reach out. I'd love to help you break free from any pain that you may be dealing with. Again, I apologize about not being tech savvy apparently, and somehow deleting that film, that recording from the actual presentation. But I hope you found this one to be at least somewhat helpful in helping you return to being free from pain and recovering fully from your injuries. Feel free to ask any questions if you have any. All right, and have a fantastic weekend. Thanks.